I am a student at Turner University, and the following role play is part of an assignment out of my psychopharmacology class. Well, thank you for sticking with me so far, Lauren.
Thank you for sticking with me for so long.
That's not a problem. I know we've spent a lot of time talking about how your classes have been going and how your grades have kind of been taking a bit of a dive. We're doing really good in class, but lately they haven't been doing so good.
Yeah.
But I was wondering if we could talk a little bit more specifically about the alcohol and how often you are drinking. If you could talk to me a little bit about that.
I don't know, lately it's kind of been brought to my attention how much I've been drinking. I mean, I would say I probably drink every day.
It's got to be a daily thing.
Yeah.
But how many drinks do you think you have a day?
I think it depends. Like, normally when I'm done with classes and stuff and I go back to my sorority house, I mean, at least a couple glasses of wine just to kind of chill out from the day. But then if my sorority's having a get-together or, like, we're hanging out with our brother fraternity, it's a lot more.
It just increases.
Yeah, it's a lot more. But no, it's definitely a daily consumption. Like, if I try and go a day without drinking it, I just feel stressed beyond belief, and I have to have.
Now, I know you kind of expressed a pretty strong desire that you want to get rid of this habit. It's not something that you really wanted to even get into.
Yeah.
And it's causing you a lot of problems, and you'd really like to get rid of it. Which I commend you on that, because that takes a lot of strength to be able to make that choice.
Yeah, honestly, I find it's going to be very difficult to stop, because I feel like it's consumed a lot of my life. But, I mean, like we were saying earlier, my grades were good. I was on the dean's list.
Yeah.
Everything was going great, and now, I mean, I'm barely passing. I'm on academic probation, and
that's kind of a difficult situation to be in.
Yeah. It's been rough. But, I mean, I know people have high expectations for me, and I used to have high expectations for myself. So, I see that slipping, and it's kind of scary, to be honest.
Well, no, I can definitely appreciate that. And again, I want to thank you for coming in. It's definitely a good, solid step towards treating this issue that you have. In addition to coming in and seeing me, there's also some medications that we could also prescribe and maybe use that might be able to help address some of these especially the cravings of the alcohol. Try to work with that a little bit. One of the drugs, disulfiram.
Okay.
It's something that you take on a regular basis. As long as you don't consume any alcohol, you won't feel any side effects from it. But it's something that kind of when you do have that glass of wine, when you do kind of get that alcohol in your bloodstream, that's when you start to get these adverse symptoms, which it'll make you feel sick is what it will do.
Oh, like nauseous and like.
Yeah, you'll get nauseated. You'll start throwing up. Long before, you're not drunk at this point. You simply introduce alcohol into the bloodstream, and then you start getting these adverse effects, and it kind of starts breaking this reinforcement that alcohol has brought. It kind of starts bringing the negative side effects into there to kind of help break that addiction.
Oh, okay, yeah, that's one way to do it. Yeah. Okay.
That's one of the drugs that we could use. There's a couple other ones that we could use that might be able to just help reduce the cravings before they don't have the adverse side effects like that. They don't make you sick.
Okay.
A few of the ones here that I have on the list here are some antidepressants. They're SSRIs, serotonin reuptake inhibitors.
That's a big word.
It is a big word. They're drugs like citrulline or citalopram.
Okay.
The way they work is they just reduce the craving for the alcohol.
Okay.
Which
I feel like that would help.
At least then you're not drinking it so much.
Okay.
It kind of reduces that and helps you manage the consumption of the alcohol. Some of the possible side effects of that also, which you may or may not experience that, and we may have to adjust the dosage in order to kind of get that targeted response without having too much negative side effects.
Okay.
But here again, you might get some nausea, sweating, some of the more serious side effects. You might have a little bit more anxiety, headaches.
Okay.
Some of the more severe ones might be dry mouth or blurred vision. It doesn't happen in everybody, but these are just some things that you kind of need to be on the lookout
just like
for.
every person's different.
Yeah.
Just
We'll
like
try,
your
we'll,
dose.
we'll kind of work with the dosage to kind of get the medication at where it needs to be.
Okay.
But one thing though, if this does ends up being kind of a long-term, use,
Mhm.
you might load it and start noticing a lack of energy to do stuff.
Oh, okay. Just kind of feel lethargic.
It'll actually start feeling the opposite, and we'll have to work with that when it gets to that point.
Just
but,
figuring out what
Mhm.
works best. Okay.
But that's a little further down the road, so. It's
Okay.
I just wanted you to be aware of that before we go forward, just so that we're all on the same page.
Okay. That's fine. I
Very
mean,
good.
it sounds like it'd be a good start.
But those are the two different approaches that we can kind of take. If you kind of wanted to start off on just the SSRIs for now, and see if we can just reduce the cravings, and
Mhm.
hopefully that will help enough. If that's not enough, then maybe we could go to the disulfiram and
Okay.
kind of work on getting that taken care of from that angle.
Okay.
But,
Sounds like a plan.
well, very good, very good. Well then, thank you so much for coming in. If I could just get you to sign this over here, where
Okay.
it's covering the different drugs. To kind of
Okay.
sign that we've talked about that, and I've kind of gone over the side effects that you could get,
Okay.
could be experiencing. And again, thank you very much for coming in, and I look forward to seeing you next time.
All right. Thank you. Thank